Hi, my name is Susan Sigward. I'm an associate professor of clinical physical therapy in the Division of Biokinesiology and Physical Therapy at the University of Southern California. I also direct the Human Performance Research Laboratory and the Master's in Science program in Biokinesiology with a sports science emphasis. The overarching goal of my research is to optimize movement following musculoskeletal injury. While my work focuses on recovery following anterior cruciate ligament injury and reconstruction, many of the themes of my research have implications for recovery of movement following musculoskeletal injury. As clinicians, we intervene at the level of recovery following injury or surgery with the assumption that if our patients follow a criterion-based progression of rehabilitation exercises, that they'll be able to return to previous activities. Despite an evidence-based framework for rehabilitation following ACL reconstruction, many studies highlight the persistence of joint impairments and movement deficits at the time at which we expect our athletes to be returning to performance or high-level activities. Now, these impairments are attributed to increased risk for re-injury and often early onset osteoarthritis. In many cases, the presence of these movement deficits reflect a mismatch between clinical expectations and reality, and are often attributed to inadequate rehabilitation process that's not prepared individuals for demands of high-level tasks at this time point. Now, this large body of work that describes unresolved impairments at the end of our expected recovery time has motivated the work in my lab. We initially approached this problem with a series of studies that assessed mechanics longitudinally starting in early rehabilitation. And much to my surprise, we found this mismatch between clinical expectations and reality can be observed much earlier in recovery, and in particular at this 3 to 4 month time period. This is an important time period because this is as a time when individuals are starting to return to sort of previous daily activities and are likely starting to reshape their loading behaviors throughout the day. In fact, at this time point, we found fairly profound deficits in knee extensor moments in tasks that would be considered submaximal, such as gait and squatting. And knee extensor moments are one of the impairments that persist across time. This is particularly concerning because, as you can see with these data, that the deficits in the surgical limb for knee extensor moments during this very submaximal task actually persisted 2 months later. And this is 2 months following rehabilitation actually targeted at this particular movement deficit. These findings led to studies that found that individuals do not spontaneously load their surgical limb during submaximal tasks, despite having the ability to do so. This is not so surprising, as we would clinically expect that individuals are able to perform squatting, sit-to-stand, and standing tasks with relative symmetry. For this study and others, I've actually borrowed experimental designs and interpretation from my motor control colleagues to examine features of a potential non-use phenomenon in these individuals, and have used different motor control gait adaptation paradigms to understand the ability of these individuals to adapt or reverse these new maladaptive behaviors. Stepping outside of the laboratory session, we found that individuals underload their surgical limb throughout the day. This is important because practice afforded in these daily activities could serve as a powerful reinforcement for maladaptive loading. Our work investigating these more ecological behaviors is ongoing. Current work in my lab is building on these initial studies by combining laboratory and ecological assessments to estimate the quality, magnitude, and volume of movement patterns practiced in early recovery. This information will be important in understanding how these movement patterns practiced throughout the day are related to recovery status or influence the quality of recovery over time. Now, while previous studies have attributed altered loading to the progression of OA in this already vulnerable population, current designs relating loading to OA progression are largely limited to single session laboratory assessments of loading. We're currently working on merging our laboratory and ecological assessments to estimate overall loading volume overall loading volume throughout the day, perhaps over time, weeks and months, and hopefully establishing mechanisms for understanding how this loading then will relate to joint health or progression to osteoarthritis. Much of this work has been done and supported by my previous PhD students, master students, and my current lab members. Also support for these ideas and concepts through the musculoskeletal biomechanics group within the division, in addition to individuals focusing on motor control and motor behavior. Also, I would like to acknowledge some of my previous funding mechanisms.